Today we're going to discuss one of medicine's most silent and deadly adversaries, pancreatic cancer. This is a disease that doesn't announce itself with dramatic symptoms or obvious warning signs. Instead, it operates like a master of disguise, hiding behind everyday aches and pains that most people would never associate with cancer. The tragedy is that by the time pancreatic cancer becomes obvious, treatment options become severely limited. But here's the thing that gives me hope. The early warning signs are always there. They're subtle, they're easy to dismiss, but they're present nonetheless. I'm going to walk you through 8 critical early symptoms that could make the difference between catching this disease when treatment is still possible and discovering it too late. These aren't the dramatic, obvious signs you might expect. These are the quiet whispers your body sends before the shouts begin. And I promise you, symptom number 5 is so unexpected and overlooked that most people experience it for months without ever connecting it to anything serious. Once you hear about it, you'll never look at this common occurrence the same way again. Before we dive in, let me be clear about something. This isn't about creating fear or making you paranoid about every little ache and pain. This is about education and empowerment. Knowledge is your most powerful tool when it comes to your health. The more you understand what your body is trying to tell you, the better equipped you'll be to take action when it matters most. So stick with me through this entire discussion, because what you learn today could potentially save your life or the life of someone you care about. Let's begin with the first warning sign that's so common. Most people completely overlook its significance. The first symptom appears as a mild, persistent discomfort in your upper abdomen, right below your ribcage. Now, I know what you're thinking. Abdominal discomfort is incredibly common, right? We've all experienced it after a heavy meal or during stressful periods. But this particular type of pain has characteristics that set it apart from typical digestive discomfort, and recognizing these differences could be crucial. This isn't the sharp, intense pain that would send you rushing to the emergency room. Instead, it's a dull, nagging sensation that comes and goes without any clear pattern. It might appear after meals, during stressful moments, or seemingly out of nowhere. The pain often feels like pressure or a deep ache rather than a stabbing sensation. What makes this symptom particularly deceptive is that it frequently improves when you lean forward or lie down in certain positions, leading many people to assume it's just a postural issue or minor digestive problem. Here's what most people don't realize. Your pancreas sits deep in your abdomen, nestled behind your stomach and close to your spine. When a tumor begins developing in this vital organ, it can create inflammation and pressure on surrounding nerves and tissues. This pressure manifests as that persistent, uncomfortable sensation in your upper abdomen. The key difference between this pain and typical digestive discomfort is its recurring nature and its resistance to common remedies. If you've been experiencing this type of abdominal discomfort repeatedly, and antacids or dietary changes aren't providing relief, your body might be trying to send you an important message. As the condition progresses, this abdominal pain often begins radiating toward your back, particularly the middle or lower back region. When pain starts traveling from your abdomen to your back, it's often a sign that the underlying issue is becoming more serious and affecting deeper structures in your body. The second warning sign is one that might seem obvious when it appears, but it's often missed in its earliest stages. We're talking about jaundice, that distinctive yellowing of the skin and eyes. Most people assume jaundice is immediately noticeable, but the truth is, it often begins very subtly. The yellowing typically starts in the whites of your eyes, appearing as just a faint tint that's barely perceptible except under certain lighting conditions. Many people don't notice this early change, or they dismiss it as fatigue or lighting effects. However, this subtle yellowing is often the first visible sign that something is interfering with your body's normal bile flow. When a tumor develops in the head of the pancreas, it can obstruct the bile ducts that carry bile from your liver to your small intestine. Bile plays a crucial role in digesting fats and eliminating waste products from your body. When these ducts become blocked, bile backs up into your bloodstream, causing a substance called bilirubin to accumulate. This excess bilirubin is what creates that characteristic yellow tinting of your skin and eyes. But jaundice doesn't occur in isolation. It's typically accompanied by other changes that serve as additional warning signals. Your urine may become noticeably darker, taking on a deep amber or tea-colored appearance even when you're well hydrated. Conversely, your stool might become paler than usual, sometimes appearing grayish or clay-colored. These changes in urine and stool color occur because bile isn't reaching your intestines normally. Since bile helps give stool its typical brown color and contributes to the normal processing of waste products, disruptions in bile flow create these distinctive changes in your body's waste elimination. Additionally, because bile is essential for fat digestion, you might notice that fatty or greasy foods become harder to tolerate, causing increased discomfort or nausea after meals that contain significant amounts of fat. Our third warning sign is weight loss that occurs without any intentional changes to your diet or exercise routine. Initially, unexplained weight loss might seem like a welcome surprise. Many people think, great, I'm losing weight without even trying. However, unintentional weight loss, especially when it's rapid and sustained, is often your body's way of signaling that something significant is wrong internally. Pancreatic cancer is particularly notorious for causing this type of unexplained weight loss, and understanding why this happens can help you recognize its significance. Your pancreas serves two critical functions in your body. First, it produces insulin to regulate blood sugar levels. Second, it manufactures digestive enzymes that are essential for breaking down and absorbing nutrients from food, particularly fats. When a tumor affects pancreatic function, your body's ability to properly digest and absorb nutrients becomes compromised. Even if you're eating the same amount of food as always, your body can't extract and utilize the calories and nutrients effectively. The result is that you begin losing muscle mass and body fat even while maintaining your normal eating habits. This type of weight loss isn't just about the number on the scale dropping. It's accompanied by other visible changes that indicate your body isn't getting the nourishment it needs. Your face may appear more gaunt, with more pronounced cheekbones and deeper set eyes. You might notice that clothes fit more loosely, particularly around your waist and shoulders. There's often a general sense of physical weakness and fatigue, as if your body doesn't have enough fuel to maintain your normal energy levels. What makes this symptom particularly concerning is its progressive nature. The weight loss often happens gradually at first, so you might not immediately notice the change. You might catch a glimpse of yourself in a mirror one day and think you look a bit thinner, or a friend or family member might comment that you appear to have lost weight. By the time the weight loss becomes obvious to others, it's often been progressing for several weeks or months. If you've experienced unexplained weight loss of more than a few pounds over the past several months, particularly if it's accompanied by any of the other symptoms we've discussed, it's important to take this seriously and consult with a healthcare professional. Now we reach the fourth warning sign, and this one might surprise you because it affects something you probably take for granted every single day: your vision and mental clarity. Have you noticed lately that reading seems more challenging than it used to be? Maybe words appear slightly blurry, or you find yourself squinting more often to focus clearly on text or objects. Perhaps you've experienced moments where lights seem unusually bright or bothersome, or you feel like your eyes tire much more quickly than they once did. You might naturally assume these changes are due to eye strain from too much screen time, stress, or simply getting older. But here's what many people don't realize. These visual and cognitive changes can actually be connected to pancreatic dysfunction, even before diabetes is formally diagnosed. When your pancreas begins to fail, one of its most critical functions becomes compromised, regulating insulin production and maintaining stable blood sugar levels. Even in the earliest stages of pancreatic problems, you might experience subtle fluctuations in your glucose levels that aren't severe enough to be detected in routine blood tests, but are significant enough to affect your body's most sensitive organs. Your eyes, particularly the delicate blood vessels in your retina, are extremely sensitive to changes in blood sugar levels. When glucose levels fluctuate unpredictably, these tiny vessels can become inflamed or weakened, directly impacting the sharpness and clarity of your vision. This isn't the dramatic vision loss associated with advanced diabetes, but rather subtle changes that develop gradually and are easy to attribute to other causes. But the effects extend beyond just your eyes. Your brain, which relies heavily on stable glucose levels to function optimally, can also be affected by these early pancreatic changes. This is why many people begin experiencing what feels like mental fog alongside their vision changes. You might find it harder to concentrate during conversations, forget things more frequently than usual, or feel like your thinking isn't as sharp as it once was. The frustrating part is that these symptoms are so easily explained away. We live in a world of constant digital stimulation, high stress levels, and busy schedules, so it's natural to blame vision problems and mental fatigue on these external factors. But when these changes persist despite getting adequate rest, reducing screen time, or managing stress, it might be your body's way of alerting you to something more significant happening internally. And now we arrive at symptom number 5, the one I mentioned earlier that most people never connect to anything serious. This symptom is so commonly dismissed that I guarantee it will change how you think about certain everyday experiences. Are you ready for this? Persistent, unexplained itching of your skin, especially when there's no visible rash or irritation present. Yes, you heard that correctly. That annoying itch that seems to come from nowhere and refuses to go away, no matter what creams or treatments you try, could be an early warning sign of pancreatic problems. This isn't the occasional itch you might experience from dry skin or a minor allergic reaction. This is a deep, persistent sensation that can occur anywhere on your body, but is often most noticeable on the palms of your hands and soles of your feet. The itching might be worse at certain times of day, particularly in the evening, and it often intensifies despite your best efforts to treat it topically. The connection between this mysterious itching and your pancreas lies in the same process I described earlier with jaundice. When pancreatic tumors begin obstructing bile ducts, bile components accumulate in your bloodstream. One of these components, bilirubin, doesn't just cause the yellowing of skin and eyes, it also irritates nerve endings throughout your skin, creating that maddening itch sensation. What makes this symptom so deceptive is that most people try to treat it as a skin problem, rather than recognizing it as a potential internal issue. You might try different moisturizers, antihistamines, or even visit a dermatologist, all while the underlying cause continues to progress. The itching persists because the problem isn't on your skin's surface, it's coming from within your bloodstream. This symptom becomes even more significant when it appears alongside other warning signs we've discussed. If you're experiencing persistent itching along with abdominal discomfort, unexplained weight loss, or subtle changes in your skin color, these seemingly unrelated symptoms might actually be pieces of the same puzzle. Moving on to our 6th warning sign, we need to talk about how your body responds to food, particularly meals that contain more fat than usual. Have you noticed that certain foods that never bothered you before now leave you feeling uncomfortably full, nauseous, or generally unwell? This isn't about occasional overindulgence or eating something that didn't agree with you. This is about a consistent pattern where your digestive system seems to struggle with foods it once handled easily. Your pancreas produces essential enzymes that break down fats, proteins, and carbohydrates in your digestive system. These enzymes are crucial for proper nutrient absorption and comfortable digestion. When pancreatic function becomes compromised, enzyme production decreases significantly, leaving your digestive system unable to process certain foods effectively. The result is that meals, particularly those higher in fat content, begin causing prolonged discomfort. You might experience that heavy, stuck feeling in your stomach that seems to last much longer than normal. Nausea might occur more frequently after meals, sometimes accompanied by a general sense of malaise that makes you want to lie down and wait for the discomfort to pass. Initially, this digestive disruption might only occur after particularly rich or heavy meals, leading you to assume you simply overindulged. However, as pancreatic function continues to decline, you might notice these uncomfortable reactions happening even after moderate meals that contain normal amounts of fat. Foods that were once staples in your diet, like cheese, nuts, fried foods, or even seemingly innocent dishes with cream or butter, might start causing consistent digestive distress. The progression of this symptom is often gradual, which makes it easy to adapt to or dismiss. You might unconsciously begin avoiding certain foods without really thinking about why, or you might start taking digestive aids more frequently, assuming you're just developing food sensitivities with age. But when this digestive disruption is viewed alongside other potential warning signs, it becomes a much more significant piece of the diagnostic puzzle. Our seventh warning sign involves something most people prefer not to think about, but it's actually one of the most telling indicators of internal health problems: changes in your bowel movements. I know this isn't the most comfortable topic to discuss, but the characteristics of what your body eliminates can provide crucial insights into what's happening with your digestive system. When pancreatic enzyme production becomes insufficient, your body loses its ability to properly break down dietary fats. Instead of being absorbed and utilized for energy, these fats pass through your digestive system largely unchanged. This creates very distinctive changes in your stool that are hard to miss once you know what to look for. You might notice your bowel movements becoming much paler than usual, taking on a grayish, yellowish, or even clay-like appearance. The consistency often becomes greasier or oilier, and you might observe an unusual sheen or film on the surface. These stools frequently float rather than sinking normally, and they often have a particularly strong, unpleasant odor that's noticeably different from what you're accustomed to. These changes occur because undigested fats are being eliminated directly through your bowel movements. This isn't just an aesthetic concern or temporary digestive upset. It's a clear indication that your body is failing to absorb essential nutrients, including fat-soluble vitamins like A, D, E, and K, which are crucial for maintaining energy levels, immune function, and overall health. What makes this symptom particularly significant is its consistency. While everyone experiences occasional digestive variations, these changes in stool characteristics tend to persist when they're related to pancreatic dysfunction. If you've noticed these types of changes continuing for more than a few days, especially when combined with other symptoms we've discussed, it represents a serious red flag that shouldn't be ignored. This brings us naturally to our eighth and final warning sign: a type of fatigue that goes far beyond ordinary tiredness. This isn't the kind of exhaustion you feel after a long day at work or a poor night's sleep. This is a profound, bone-deep weariness that doesn't improve with rest and seems to drain your energy for even the simplest daily activities. This overwhelming fatigue has two primary causes when related to pancreatic problems. First, the malnutrition that results from poor fat and nutrient absorption deprives your body of the essential building blocks it needs to produce energy. When your system can't properly process and utilize the food you consume, it's like trying to run a car on watered-down fuel. Everything becomes more difficult and less efficient. Second, the inflammatory processes and cellular changes associated with pancreatic dysfunction create an additional energy drain on your system. Your body is working overtime, trying to compensate for compromised organ function, consuming resources and energy at an accelerated rate while receiving inadequate nutritional support. The result is a fatigue that feels disproportionate to your activity level. You might find yourself exhausted after simple tasks like grocery shopping, climbing a flight of stairs, or even having a conversation. Mornings might feel particularly difficult, as if you are starting each day already depleted. This isn't depression or laziness, it's your body's way of conserving energy when it's not receiving adequate fuel to function normally. When this type of persistent, unexplained fatigue occurs alongside the digestive changes I just described, along with any of the other warning signs we've covered, it creates a pattern that demands immediate medical attention. Now that you understand these 8 critical early warning signs, the question becomes, what are you going to do with this knowledge? Are you going to continue dismissing those subtle signals your body has been sending, or are you going to start listening more carefully to what it's trying to tell you? I want to be absolutely clear about something. Experiencing one or even several of these symptoms doesn't automatically mean you have pancreatic cancer. Many conditions can cause similar symptoms, and your body might be alerting you to something entirely different that still requires attention. The goal isn't to create panic or make you hypervigilant about every minor discomfort. The goal is to help you recognize patterns that warrant professional medical evaluation. Your body has an incredible ability to communicate with you, but it often speaks in whispers before it's forced to shout. Those seemingly insignificant aches, that mild digestive discomfort, that persistent itch you keep meaning to address, that gradual weight loss you've been secretly pleased about, these could all be early conversations your body is trying to have with you. The difference between catching a serious condition early and discovering it too late often comes down to paying attention to these subtle signals and taking action when they form a concerning pattern. Early detection transforms the entire trajectory of treatment and outcomes. What might be manageable with prompt intervention could become devastating if ignored until symptoms become impossible to dismiss. If you've recognized yourself in several of these descriptions, please don't wait. Schedule an appointment with your healthcare provider and have an honest conversation about what you've been experiencing. Bring notes if necessary. Be specific about when symptoms started, how they progressed, and how they're affecting your daily life. Don't let embarrassment about discussing bowel movements or seemingly minor symptoms prevent you from advocating for your health. Remember, medical professionals are trained to piece together these types of symptom patterns. What might seem like unrelated complaints to you could form a clear picture for someone with the right training and experience. Your job isn't to diagnose yourself, it's to provide accurate information about what your body is experiencing. Knowledge truly is power when it comes to your health. By understanding these early warning signs, you're now better equipped to be an active participant in your own healthcare. You can ask better questions, provide more relevant information to your doctors, and most importantly, you can take action when your body needs you to listen. If this information has opened your eyes to new possibilities or helped you understand concerning symptoms you've been experiencing, please share this knowledge with the people you care about. Sometimes the most valuable gift you can give someone is information that could potentially save their life. Your health is your most precious asset, and protecting it starts with education, awareness, and the courage to act when something doesn't feel right. Trust your instincts, listen to your body, and never hesitate to seek professional guidance when you have concerns. Because at the end of the day, taking care of yourself isn't just about you. It's about everyone who depends on you being healthy and present in their lives.